Cyanocobalamin or vitamin B12 is supplemented in cases where the person has a vitamin B12 deficiency, either because their body isn't able to absorb it due to some effects of aging often, and I'll expand on that a little bit, or because they have true pernicious anemia, which is an autoimmune condition. I'll point out that there isn't as much said about supplementation with vitamin B12 in the anemia drugs chapter as there is in the vitamins and minerals chapter in your textbook. So I'll flesh out a little bit here what is sort of not said in the anemia drugs chapter. So vitamin B12 is one of the B vitamins that we need. We ordinarily get plenty of vitamin B12 in our diets, but people who have the autoimmune condition called pernicious anemia are lacking in intrinsic factor, and so they are not able to absorb B12 normally. The truth is that there are other non-autoimmune reasons for being less able to absorb vitamin B12, and the one that's most common is atrophic gastritis, and the prevalence of this will go up in the elderly. So it's not unusual to see older adults less able to absorb B12 and showing some signs of vitamin B12 deficiency. So there are over-the-counter preparations of B12 that are available. And these preparations are probably adequate to treat the malabsorption issues that the elderly have. Just give them a higher supplemental dose and they will probably be able to absorb more of it than what they can get from their food. But for people who have true pernicious anemia, autoimmune disorder, lack of intrinsic factor, they are probably going to need higher doses of the B12, and so very likely will be given their supplementation by intramuscular injection. And in this case, it's given not daily, but more like monthly as a deep IM injection in larger doses to make sure that they receive adequate doses. There are some of the classic signs of anemia go along with vitamin B12 deficiency, but vitamin B12 deficiency is also associated with neurologic disorders. Some that can be rather severe, memory loss and others, central nervous system disorders. So B12 is a really important vitamin that we don't think about that much. For patients with true pernicious anemia who have a severe issue with too little vitamin B12, they're going to need ongoing or follow-up care to make sure that the treatment is effective for them. And it's generally a true statement that people who have anemia and are given supplementation are going to need to go back and have the blood work drawn, have their blood work done to check their hemoglobin, hematocrit, and the red blood cell morphology to make sure that their anemia is being properly managed and reversed.